Hi, I'm Dr. Michael Reilly, a double board certified head and neck reconstructive and facial plastic surgeon. I'm really glad you're taking the time to watch this quick informational video about balloon sinuplasty. If you're contemplating what to do and whether to undergo this procedure, I'm hoping to share some information with you to help in your decision-making process.
So what is a balloon sinuplasty?
A balloon sinuplasty is a nasal procedure to treat blocked sinus passages. Your paranasal sinuses are 8 air-filled spaces that surround your nose, 4 on each side. If the passages to those spaces are narrowed, you may experience chronic sinus pain, infections, congestion, or an altered sense of smell. A CAT scan can help determine which of the sinus openings are narrowed or obstructed. Our cutting-edge 3D navigation system is used during the procedure to direct the balloon to the inflamed sinus passages. The balloon is then inflated delicately to dilate the narrow area, much in the way that a blocked artery might be unclogged by angioplasty. In contrast to more traditional sinus surgery, balloon procedures can be done under local anesthesia, and the recovery period is just a day or two rather than weeks.
Okay, so how's a balloon sinuplasty performed? Am I going to have scars after this type of nasal procedure?
With balloon sinuplasty, there is no cutting of the nasal bones, cartilage, or surrounding skin. I insert a small, flexible catheter into the nasal passages and inflate the balloon device, which quickly opens the narrowed passages in the sinuses. When the balloon is inflated, it restructures and widens the walls of the sinus passageway while maintaining the integrity of the sinus lining. This procedure has absolutely no effect on your outward appearance.
Okay, so what are the benefits from having this procedure performed in the clinic instead of in the operating room?
When the procedure is performed in the clinic, you won't have to undergo general anesthesia, which reduces the time and risks of the procedure.
Okay, so if I'm a candidate for the office-based procedure, what will it feel like? Can I drive myself home after?
If you're not undergoing general anesthesia, we will use a local anesthetic so you won't feel pain. You may feel some pressure and you will likely hear the sounds of the sinus passages being molded by the balloon. Most patients who undergo this procedure in the office will also take some mild relaxing medication and therefore will need a friend or family member to drive them home.
Am I going to feel any pain or discomfort after this procedure?
I recommend taking 1,000 milligrams of Tylenol 1 hour prior to the procedure to minimize any discomfort. The vast majority of patients quickly feel a sense of relief after the procedure, usually within a day or two. The pain is fairly minimal.
When can I expect to get back to work?
If you undergo an in-clinic balloon sinuplasty procedure performed under local anesthesia, you can expect to be back to work in 1 or 2 days. You should also expect to enjoy the results more quickly than you would with the more traditional invasive sinus surgery.
Okay, great. So how much does a balloon sinuplasty cost?
Although the balloon device and all the technology is expensive, a balloon sinuplasty is typically covered under medical insurance benefits. Often patients see less out-of-pocket costs for procedures like this done in the office than they would for procedures in the operating room. We have a team of people who help navigate you through the scheduling process, submission for insurance authorization, in order to help determine what your out-of-pocket costs might be. Thanks so much for watching this informational video about balloon sinuplasty. I hope it proved to be useful for you on your journey to discover if this is the best procedure for you, and I'll look forward to taking care of you.